disaster simulation exercise is an exercise put together for students and the population at large that mimics real-world environments, that allows us to pull in multiple facets of training for our students, all in an effort to put them in scenarios that are more critical and crisis-related, that expands their knowledge, improves their critical thinking, and kind of drives them to be a better nurse. Having that ability to critically think in a short period of time in an austere environment or under duress is something that is paramount nowadays.
As student nurses, not knowing what to expect, quite naturally going in, we were nervous. But in a real life situation, if you are the nurse and you are the caretaker and you're providing care, it is most important that we remain calm. This is an opportunity for me to learn, and I'm going to get feedback that I can use to perform better in the field, like in real life.
There are 4 stations in our disaster simulation. Those stations consist of Stop the Bleed, which is a hemorrhage control station, an airway and breathing station that helps them understand how to address breathing and respiratory issues, a triage area where they learn how to color code their patients based on the conditions that they see and assess immediately. And then lastly, we put them in kind of an austere environment where still having to not only now assess, but triage and also treat in that environment. They're able to learn how to manage their own anxiety, their own stress, which they're going to have to do no matter where they work in nursing.
I was amazed at how much work and effort went into planning this, because when I talked to some of my other friends who are nurses, they didn't experience anything like this when they were in nursing school. The actors really did act the way that patients would act in a disaster. So in order to keep the patients calm, you have to go in with a certain confidence and assertiveness to show the patient that you are a trained professional and you know what you're doing. You never know what to expect, but we're trained for this. And that's what our faculty is doing. They're training us to be calm under that kind of pressure. And I'm much more prepared.